Good evening, everyone. We thank you for joining us this evening as we are about to begin our special health emphasis program. We invite you to bow your heads for prayer. Almighty Father, we thank you, Lord, for the blessed hope of salvation that you have gifted us. As we come this evening to discuss matters pertaining to our health, Father, we pray in a special way that you will be with the panelists, be with the technology, that everything will go according to plan. And we ask, oh Father, that your people will indeed be blessed by that which is presented this evening, and that we will put into practice what we would have learned at the end of this session. May you pour your blessings upon us now, we pray, in your Son's precious name. Amen.
Amen. Amen. Good afternoon, everyone. The Andrews Memorial S.D.A Adventist Group of Churches, Health Ministries Department, is pleased to present its first in a series of sessions, Ask the Health Professionals. I am Dr. Sherrard Little, and this afternoon I will host a distinguished panel of health professionals. Let me first welcome all of those who are joining us in the virtual platform. This promises to be a very informative afternoon. Let me also welcome our distinguished guest, Dr. Jerome Stern, general practitioner and member of the Andrews Seventh-day Adventist Church, Dr. William Aiken, consultant urologist at the University Hospital of the West Indies, Dr. Judith Leiber Thomas, Director of Child and Adolescent Health in the Ministry of Health and Wellness, and Dr. Craig Radlin, Head of the Kingston and St. Andrew Community Health Mental Health Service. This afternoon we'll be focusing on general health and mental health, and we'll also be focusing on male health issues. In our next session, we'll focus more on women's issues. Now, people are always concerned about their health, and especially in light of our global health pandemic, people are placing more emphasis on health. This afternoon, we have assembled a panel of expert practitioners to answer your questions. Well, how we will conduct this session is that each of the health practitioners will present a brief talk on an area, and then we're going to open the forum for persons to ask questions. You can post your questions in the comment section of YouTube. We'll see those questions, and as a moderator, we'll direct these questions to the health professionals. So we'll present in this order. Dr. Jerome Stern will present first, followed by Dr. William Aiken, and then Dr. Judith Leiber Thomas. By way of introduction, Dr. Jerome Stern is a general practitioner at the Andrews Memorial Hospital and has been practicing family medicine for the last 40 years. He has a master's in public health from the Loma Linda University, and his interests also include health promotion based on biblical principles. Dr. William Aiken is a consultant urologist at the University Hospital of the West Indies, and he's also a senior lecturer in the Department of Surgery. He also has postgraduate training in epidemiology. He is a past president of the Caribbean Urologic Association, the Jamaica Urologic Society, and also the Association of Surgeons of Jamaica. He's well published, and I'm sure we're in for a treat this afternoon when it comes to male health issues. Dr. Judith Leiber Thomas simply describes herself as a pediatrician who fell in love with psychiatry, especially child and adolescent psychiatry. She is director of the Child and Adolescent Health in the Ministry of Health and Wellness, and she has worked in the child guidance clinics for over 20 years. Dr. Radlin He's a graduate of the University of the West Indies who trained in psychiatry and also has a master's in public health. He is currently head of the Kingston and St. Andrew Mental Health Community Service and is also vice president of the Jamaica Psychiatric Association. So as you can see, we really have a top panel of experts in their areas who are going to answer your questions this afternoon. I'd like to start off with Dr. Jerome Stern. Dr. Stern, can you unmute your mic and speak to us?
Okay. Thank you again, Dr. Little, and welcome everyone to this session, this initial session of this Asking the Health Professionals. My overall concern, my concern this evening is to do with the need for enhancing our immune system, especially in the light of COVID-19 that all of us are facing. Questions are occupying people's minds as to what is the best way to increase our resistance or reduce the risk of catching this disease, this virus. And there's a lot of discussion about methods like possibly in getting a vaccine. But I'd like to say that just as important as getting the vaccine is doing our best we can to enhance the vibrancy of our immune systems and how to go about that. Well, in summary, I'd like to look at, first of all, the importance of exercise even in this matter of being restricted, what we can do for improving our immune system by doing exercise. You know, exercise, according to an article by Doctors Peter Landless and Dr. Alan Handisides in a November 9, 2016 issue of the Adventist magazine, Adventist World magazine, they have put forward here a summary of the benefits of exercise as provided by the physical activity guidelines for the Americas. And in this article, it says that these guidelines are applied to all societies, all ethnicities, and across all nations. So it applies to our Jamaican society as well. And in that summary of the benefits, we want to look at, first of all, the health benefits associated with regular physical activities for children and adolescents. And there's strong evidence here that exercise has improved cardiorespiratory and muscular fitness for children, improved bone health, improved cardiovascular and metabolic health biomarkers. That is cardiovascular, to do with the heart and the circulatory system. And the metabolic, has to do with the body's chemistry as it goes through handling the growth processes and the processes of digesting food and storing nutrients, etc. So exercise has improves cardiovascular and metabolic health, including as measured by things like cholesterol and blood sugar, etc. Exercise for children also has a benefit in providing favorable body composition. So that is strong evidence for that. For children also, there is moderate evidence that it helps to reduce symptoms of depression. And probably Dr. Leiber Thomas will be coming and we're talking about, or Dr. Radley will be talking about that. Then for adults and older adults as well, there's strong evidence that exercise lowers the risk of early death, lowers the risk of coronary heart disease, that is heart attacks, lowers the risk of stroke, lowers the risk of high blood pressure, lowers the risk of adverse blood lipid profile, that has to do with cholesterol and blood fats, lowers the risk of type 2 diabetes, which is very common, lowers the risk of metabolic syndrome, especially that's related to people being overweight and all the chemical imbalances that comes from that, to do with poor blood sugar management and poor blood level of fatty substances in the blood lipid profile. It lowers the risk of colon cancer, lowers the risk of breast cancer, and helps to prevent weight gain. Weight loss is also promoted by regular exercise, particularly when combined with reduced caloric intake. So diet and exercise go together, and this is important for enhancing the immune system. It goes on under the heading of strong evidence for exercise that enhances health. It helps in the prevention of falls. And falls, frequent falls are a dreaded thing for adults, and especially older adults. So frequent falls can lead to a lot of severe complications, hip fractures, head injuries, and so forth, and can be fatal. So regular exercise can reduce the risk of falls, reduces the risk of depression, and promotes better cognitive function, better mental function, especially for older adults. Then there's moderate to strong evidence that exercise promotes better functional health. That is, it enhances the ability for people in their everyday life, physical and mental activities, to improve the functions in those areas. And also, there's reduced abdominal obesity. Next to that, there is moderate evidence that exercise helps in lowering the risk of hip fractures, lowering risk of lung cancers, lowers the risk of endometrial cancers, weight maintenance after weight loss, increase bone density, and improve sleep quality. I just say that in summary, in that how can we exercise in this time when we are probably locked up at home? Well, for those who feel like they are locked up at home under quarantine, you can do exercises in your room, sitting in a chair, etc. But those who don't have the disease and want to enhance their immune system, remember we can be doing regular walking, at least doing exercise and half an hour, at least 5 to 6 days a week, with brisk walking, or even if not brisk, at a moderate pace, so that we can sweat a little but not become breathless. We also want to enhance our immune system by dietary measures. And in the studies, in the same magazine, in 2017, there was this study by Dr. Landless and Dr. Charles Marcel, Charles Marcel. In summary here, I'm just quoting from a part of it. They're quoting from a large study. Investigators created an overall plant-based diet index, and here they had plant foods receiving positive scores and animal foods receiving negative scores as part of their study. They had also healthy plant-based indexes in this study. And generally speaking, it was found that persons who had a high index, index of plant-based foods, as a matter of fact, they studied 4,102,369 person years, and came up with the conclusion that other the things like type 2 diabetes and other diseases, there was improved outcomes for persons who had a healthful plant-based diet index. What you're trying to say here is that what people can do is improve their intake of fruit, vegetables, raw fruit, raw vegetables, or even cooked vegetables in this time, and avoid sugary drinks, sweet drinks, desserts. Those were on the plant list or less helpful plant list, helpful plant food list. And so fruit juices, sweet drinks, beverages, animal foods, these received a negative score and were actually not helpful in promoting the immune system. So be careful in your eating in your diet to enhance your immune system by improving the intake of plant, fruit, and vegetables. Also, we want to look at maybe overall summary of this by a concept called the New Start concept, whereby N is for nutrition, E is for exercise, W is for water, S is for sunshine, T is for temperance, self-control, A is for air, R is for rest, and T is for trust in God, trust in the Creator. That concept has been summarized in a book, one of my favorite books called The Ministry of Healing. And I read that many years ago on page 127, where the author, Ellen White, said, pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. Every person should have a knowledge of nature's remedial agencies and how to apply them. It is essential both to understand the principles involved in the treatment of the sick and to have a practical training that will enable one rightly to use this knowledge. And this was written up more than 120 years ago, and how appropriate it is even to us now to be using these principles when we are thinking to enhance our immune system's function. I want to also focus on, as part of our present concern, people eating, concern about getting food fast foods. And for us to just realize that a lot of these fast foods has factors engineered into them that cause people to be hooked on them. So we want to be careful about foods that have excitotoxins in them that makes you want to eat some more. You know, it melts in your mouth and it goes down fast. And that's, for instance, cheese is filled with excitotoxins, and people like to eat cheese. Cheese increases the mucus content in the body, and that enhances how the virus might multiply in our system, especially in our nasopharynx, in your nose and the throat. So be careful with the animal foods, especially the fast foods and the excitotoxins. I don't know if we have much more time to talk about them here. I was told that I'm just had to make some general remarks at the beginning. So, and I just close by saying we need to ask ourselves a question, especially in this, well, in light of what's happening in North America. Why is it that Black people die sooner and get sick quicker and faster? What is behind that? Well, if time allows, I'd like to direct our audience to look at a website called the slavefoodproject.org. Slavefoodproject.org. It's hosted by two doctors, a cardiologist, and an intensivist. Excellent information to answer that question. Why is it here such a high proportion of persons in the United States that would die from the COVID are Blacks and Hispanics, when they are making they comprise a lower proportion of the general population? It has to do with the diet, among other things, of course. I'm going to hand over back to you, Dr. Little. I think I've probably gone over my time.
Thank you very much, Dr. Stern. Your advice was very timely in terms of New Start and the principles that are involved there. And I think once we adopt those principles, we're well on our way to good overall health. Now, despite practicing these principles, sometimes we still get sick. And I'm told that Jamaican men are at higher risk for prostate cancer, probably one of the highest risk in the world. I want to know why this is the case. I think we have an expert on in the person of Dr. William Aiken, who is a urologist at the University Hospital. Dr. Aiken?
Thank you very much, Dr. Little. Thank you for having me. So I have some very brief introductory remarks to make. And they speak to our general state of our overall health. So there are a lot of different variables that go into the state of health that we have. There are what are called non-modifiable risk factors that we have and modifiable risk factors. The non-modifiable risk factors we really can't do anything about. Things like our family history, or race, or sex, whether we are male or female. Those things we really can't do anything about. We can't do anything about the experience that we had when we were in our mother's womb, the intrauterine experience, which has a lot of bearing on some of the illnesses that we may suffer from later on in life. We have very little control over the exposures we experienced as children. But we do have choices over the modifiable risk factors. And Dr. Stern alluded to some of these. The things that we put in our mouth, the amount of exercise we get, whether we decide to smoke or not, whether we decide to drink alcohol or not and drink it excessively, whether we decide to get adequate amounts of sleep per night. All of these modifiable exposures determine our state of health down the road. The choices we make today regarding those modifiable risk factors will determine our state of health 5, 10, 15, 20 years from now. So in my opening remarks, I want to stress that our health is very much our responsibility. Yes, it is true. There are some things that we have no control over. As I said, there are some non-modifiable risk factors like our race, whether we are male or female, what our family history is. But on the other hand, there are things that we can control. And these include our diet, whether we exercise or not, the type of exercise we do, how much sleep we get, whether we regularly go to the doctor. We know men have very poor health-seeking behavior in general, but certainly it's recommended after age 35, certainly by age 40, that men should at least once a year get a general checkup. And I'm going to speak more specifically regarding the prostate later on. But in these opening remarks, I really want to emphasize that to a large extent, our health is in our hands, our state of health, and the choices we make today regarding all of these modifiable risk factors that we have mentioned so far will determine our state of health in the future. And the state of health we enjoy today or don't enjoy is based in part on the decisions that we made in the past. So hopefully in the next couple of hours, we'll be discussing more about these choices. And at the end of this presentation, I hope we'll all be better informed so that we can make the right choices regarding our health. Thank you very much.
Thank you very much, Dr. Aiken. And it sounds like it comes back to just the individual choices that we make in terms of our health. What we eat, how we exercise, managing our stress levels, things like this, which go into overall health. And I see the questions coming in fast and furious. There are some for you, Dr. Aiken, but we're gonna switch to Dr. Leiber Thomas, who is gonna introduce herself and what she's gonna be talking about this afternoon. And then once that's done, then we'll open the forum for questions. Dr. Leiber Thomas, welcome. Thanks for coming on.
Thank you very much, Dr. Little, and welcome to everyone who is on the platform. It's my pleasure really to participate in this. I am going to just give a few remarks and I'm going to set the stage for how we function in this pandemic, what I call the 7 R's of resilience. And resilience means bouncing back. How do we bounce back from this threat, which is around us and doesn't seem to be going away fast? So the first R is reflection or prayer life. Thinking about our emotions, trying to manage our emotions is very important. The reflection part is very important. The next R is relaxation. What do you do to relax? Do you do crossword puzzles? Do you write a journal? Do you do gardening? And there's also a relaxation strategy in terms of deep breathing. Breathing in for 4 seconds, holding it for 4 seconds, breathing out for 4 seconds, and then not doing anything for 4 seconds. And that's an exercise which I would like everyone to learn and to practice, because it really relaxes you when the anxiety and tension starts. The next R is responsibility. We have to take responsibility for our actions now. We have to try to be thankful. We have to try to be positive, and we have to try to work smarter. And we're doing that now in terms of this Zoom meeting. The next R, I put the two together, refueling and rest. Refueling has to do with food. Dr. Stern spoke to that. And rest, I know our youngsters sometimes feel that they don't need rest, but they need it just as much as anybody else. 6 to 8 hours. Put away the phone, let the room be as dark as possible to get real good rest. Next R, recreation, which includes exercise. Again, Dr. Stern alluded to that. And I would put a definition for good recreation. It's something that makes you feel good, but is also good for you. Because we know that, like drug abuse, smoking marijuana, I see a question here. Some drugs may make you feel good, i.e., you're not as anxious or as aggressive or as sad, but it creates another problem. So good recreation, something that you do that is good, that makes you feel good and is also good for you. And then finally, my last R is resources. No matter how well we may abide by all of these health rules, sometimes life becomes too much. We may need somebody to talk to, a friend or a counselor. And we in the Ministry of Health have started a helpline, which is 24/7, 888 New Life, 888 New Life, 639-5433. It's a mental health and suicide prevention helpline if ever you feel that life is just too much and you need somebody to talk to. Thank you.
Thank you, Dr. Leiber Thomas, for that. And maybe we can just type that hotline in the YouTube group so that persons online can just see that. So if anyone ever feels stressed, feeling that they can't cope, they can just call into that hotline and make use of the resources which are available through the ministry. So thank you again for our panelists who have had brief introductions. And now it's really open to questions, and I can see the questions coming in fast and furious. And I'd like to start off with the first question. I want to direct this question to Dr. Radlin, who we haven't heard from yet. Dr. Radlin, what is mental first aid? What is that?
Right.
Dr. Radlin, yes.
Yes.
Can you just
sure. Oh, sure.
Activate your video? Yes, thank you. Welcome, Craig.
Yes, thank you. Again, Dr. Cornwall for inviting me and for joining this distinguished panel. And thank you for the audience members who have tuned into our discussion. So the panelists all mentioned the point that we're all going through a particularly difficult time. And during this pandemic, it's not uncommon to see many persons having anxieties, uncontrolled, depression, seeing rising stress levels, with persons being laid off, with persons fearful of succumbing to this awful virus. It is a well-established technique, psychological first aid, developed years ago, really for persons who were who had encountered disaster, and to manage post-traumatic stress disorder. But we recognize that the basic principles of this technique could be applied to many, many scenarios. So we're essentially, persons are looking out for you observe persons who may be suffering from mental illnesses, suffering from the signs or showing signs of mental illnesses. They may be withdrawn, may be depressed, have no energy, unable to function in social and in their occupational conditions. So the basic principles are these: you look, listen, and link persons to the relevant health providers. So you find if persons are not able to function, describing experiences of hypervigilance, persons who are complaining of nightmares, those things, persons suffering from PTSD, post-traumatic stress disorder, and depression and anxiety, as the things I've mentioned. Those persons can get early treatment, and that is the purpose of the community mental health service. The community mental health service is there to provide early treatment, to provide ultimately better treatment outcomes for persons who can access the treatment early, as opposed to persons who present later on. As Dr. Aiken mentioned, men are poor health seekers. So we find that men are presenting to our services with severe presentations of the conditions. They're presenting with psychotic presentations of depression, anxiety, psychotic disorders that require usually emergency attention. They have to be brought into hospitals, they require hospitalization, etc. Whereas we're seeing our ladies are presenting earlier, and they're brought in, get more support, they get early treatment, early intervention, and better treatment outcomes. So we're not seeing that's the same treatment outcomes with male versus female. And I guess that's relevant to our discussions amongst males. So that is one of the things I want to mention. Psychological first aid is a technique used to, it can be not only for health providers, but we're right now, Dr. Leiber will tell you that the government is rolling out a program in conjunction with PAHO and Red Cross, where persons in the community are going to be trained to provide psychological first aid by identifying and identifying respectfully persons who need to be linked to the health services. And Dr. Leiber mentioned to you some of the contact hotlines that we are now in existence. There is a community mental health service, which I am the head of in Kingston, but they're also operating throughout the island. Jamaica is one of those unique places. It's not found many places where we have a community mental health service where we come to your home and provide you with treatment if you so desire, or escort you if the need arises based on the mental health laws, carry you in for emergency treatment. So each health department, each parish has a health department that has a mental health service There's a telephone number attached to each service that you can contact. Call them. The police in each health division is aware. So if you're unaware, you can also ask the police for guidance to connect you to the health services. So I'll leave it there for now.
Thank you very much, Dr. Radlin. And if you could just type that number in the YouTube group in terms of how we get in touch with the mental health service in Kingston, for those people who are in Kingston, if you have the one for St. Catherine as well. Thank you very much. So I see questions here. I'm going to direct the next question to Dr. Aiken. And there are two questions around erectile dysfunction. One question is, can diabetes cause erectile dysfunction? And another question is, what are the natural ways to treat erectile dysfunction?
Thank you for those questions. So yes, diabetes mellitus, or what Jamaicans commonly refer to as sugar, is a well-recognized cause of erectile dysfunction. Diabetes causes erectile dysfunction in a number of ways. It affects the nerves, it adversely affects the nerves that supply the penis, and it also helps to cause what is known as atherosclerosis, which is a narrowing of the blood vessels, but it also adversely affects the health of the blood vessels. So it prevents the blood vessels from easily relaxing and thereby impairing the blood flow into the penis. So it not only affects the nerves, but it affects the blood vessels. An erection is what is called a neurovascular event. That's just a big word, meaning that it involves both the interplay of healthy nerves and blood vessels for a normal erection to occur. So diabetes, which adversely affects both these systems, both your nervous system as well as your vascular or blood vessel system, significantly causes impaired blood flow into the penis and is strongly correlated with erectile dysfunction. Almost invariably, if somebody has diabetes, even if it is well controlled, they will be at a higher risk of getting erectile dysfunction compared to someone who doesn't. But of course, if your diabetes is poorly controlled, then the effects on the nerves and the blood vessels will be accelerated, and erectile dysfunction will tend to present earlier, and it will tend to be very severe. In terms of natural remedies to prevent erectile dysfunction, I think you heard them earlier. So you can well imagine that if an erection involves the nerves and the blood vessels, then anything that we do to keep the nerves and the blood vessels in a good state of health would help our erections. And so Dr. Stern referred to some of these earlier. Daily exercise that increases your heart rate for a minimum of half an hour, done at least 4 times a week. Eating healthily, making sure that you eat in such a way that you do not eat a lot of animal fat and saturated fat, processed meats, and foods that will generally cause a lot of inflammation to the blood vessels. Making sure you do not become overweight and obese. This is a big one, because when you become overweight and obese, not only does your body encounter what is called a pro-inflammatory state, and in this pro-inflammatory state, the blood vessels do not relax easily, but the male hormone testosterone, which is very, very important for normal erections to occur and for a man to have his normal level of desire, in overweight and obese persons, the testosterone production is reduced. So, and of course, being overweight and being obese does predispose to diabetes. It causes what is called insulin resistance, and that eventually may reach to a point where you become diabetic. So these are some of the things that you can do to prevent yourself developing erectile dysfunction, making sure you exercise regularly, eating a healthy diet, avoiding becoming overweight and obese, and dealing with stress, psychosocial stress. You know, sex is, they say the brain is the most important sex organ. And it is true, because the psychic milieu that's necessary to have normal sexual relations and a normal sexual cycle is all dependent on what's happening within the brain. And so if a man is under a lot of psychosocial stress, this will inhibit the normal interplay of different neurotransmitters that are released in the brain to allow for normal sexual function. So managing and dealing with stress is very, very important. So these are some of the ways that you can prevent erectile dysfunction.
Thank you very much, Dr. Aiken. I'm going to address the next question to Dr. Stern. There's a question that's asking, how often should we exercise and for how long? How often should we exercise and for how long?
Okay, thanks, Dr. Little. Well, ideally, we should exercise every day. In our modern high pressure life, that might not be so possible. So we like to say that a minimum of 4 times a week, or even better still, 5 times a week if possible. And it should be at least half an hour, although there are studies that say even 20 minutes of activity is good. And this exercise is a non-stop activity, not being busy. Like some people say, well, I'm busy at work. I'm walking up and down, but they may walk for 5 minutes from one place to another 5 minutes or 2 or 3. But exercise means non-stop activity for at least 20 minutes to half an hour. Best if we can make it 7 days a week. If we can make it 7, well, at least 4 or 5 days a week. It should be enjoyable. So we should not be doing something that makes us feel stressed out or distressed ourselves, so to speak. It should cause a little sweating, but it should not be so severe as to cause the person not to be able to speak. So we can call that a talk test. If we can't talk, it's too severe. So slow down on walking or jogging, and you don't have to jog anyway. Just walking is the best, is said to be the best exercise. So that's the general rule. If we want to include aerobic exercise, something that makes you breathe deeply for a few minutes, also, and makes the heart rate pick up, that also, of course, should be part of it. It should not be just so easy that you're not sweating at all. And the time of day might be important, although that question wasn't asked. I think, and people vary, I think the morning hours when it's cool is better. Maybe some persons' schedule don't allow for that, so they might prefer exercising in the evenings. But keeping quite directly to the question, 5 times a week at least, 4 to 5, at least a half an hour. And
thank you very much.
Yes.
Thank you very much, Dr. Stern. Dr. Radlin and Dr. Leiber Thomas, I see a few questions coming up in the group surrounding Alzheimer's disease. What is it? Is there Alzheimer's support groups available? So can one of you address Alzheimer's disease? What is Alzheimer's disease? Dr. Leiber or Dr. Radlin?
All right, so
Sorry.
can you see me?
Yes, we're seeing you.
Okay, so that's one of the neurocognitive disorders. There are several subtypes. Alzheimer's is one type where there is a plaque that is laid down in the brain tissue, brain substance, and that causes cell death in the brain substance. And as that progresses, as the plaque deposition worsens in the brain, you end up with loss of function, loss of memory. So the person suffering from this condition lose their ability to conduct activities of daily living. So they move from being independent to persons who need support. So Alzheimer's is one of those. You can have an early type. So usually persons are suffering from this condition in their 70s, 80s, but you do have persons who are genetically predisposed, and you might see persons suffering from this condition in their 50s and 60s. So it is a disorder which we right now have no cure for, but there are medications that we can use to delay in the early, when presenting early, we can delay the worsening and improve the quality of life a little bit for persons who have this condition. In general, persons will require support, palliative care, and to, as I said, improve the quality of life. So it's one of the neurocognitive disorders that can be substantially reduce the quality of life and can cause death.
Okay, thank you very much, Dr. Radlin. I see another question on mental health coming in here. The person is asking, how can they assist someone who has mental health issues as a result of marijuana use?
All right, so cannabis use is very, very prevalent in our society, and cannabis use disorder now is where you have persons using it even though it's causing social, occupational, physiological harm to their when they use it. So they use it beyond, right now there's a big debate about the therapeutic value of medical cannabis and this kind of thing. There's still a debate. We still haven't found the perfect combination of the endocannabinoids, the THC, the CBD. These are substituents of cannabis. But in terms of getting treatment, there are treatment, as I said before, the community mental health service offers a site in your nearest health center, nearest clinic. There are persons who offer, the NCDA, National Council of Drug Abuse, offers services for persons who have this cannabis use problem. And of course, there is a drug.
Yeah, and then sinus issues is creating
drug use disorders.
Okay, put that in now.
When severe, you might require admission, because sometimes cannabis can induce psychotic presentations, which will require emergency treatment, as mentioned before. Emergency room treatment might even require hospitalization. And of course, there is the long-term treatment facilities by way of the Addiction Treatment Substance Abuse Unit at Ward 21, and there are long-stay treatment facilities by way of Patricia House, Teen Challenge, those things. There are treatment sites depending on the stage of their presentation and their severity.
Okay, thank you very much, Dr. Radlin. Back to you, Dr. Aiken. Question here, a patient has an enlarged prostate. A biopsy was done, shows no cancer, but urine retention has become bothersome. What is the best treatment?
Okay, thank you for that question. So there are two conditions that affect a man as he ages. One is known as BPH, or benign prostatic hyperplasia, which you could think of as non-cancerous enlargement of the gland. And the other one is prostate cancer. These two conditions affect aging men. And so BPH, essentially, as a man gets older, the prevalence of BPH increases. And some of the men with BPH, a prostate gland size actually enlarges, and it may cause obstruction to the outlet of the bladder. As it causes obstruction of the outlet of the bladder, a man may get certain symptoms. He may find he's getting up often at night to pass urine. And when he gets up, it's just a small amount of urine. He may find that he's going more frequently during the day to pass urine. And again, small volumes of urine are passed. He may find he doesn't get much of a warning. So he may be in a car driving home or in a meeting at the supermarket. And then all of a sudden, he has a sudden urge to pass urine that he cannot postpone, or else he will wet himself. And sometimes that does in fact happen, that the urine comes down and the man soils his clothes. In terms of other symptoms the man may notice, he may notice when he goes to the bathroom to pass urine that it takes a long time for the urine to start flowing. And when it does flow, it comes out very weak or very slow. Sometimes it just dribbles. And he may find that the urine stops and starts and stops and starts in an intermittent fashion. And that when he's finished passing urine, he feels like his bladder is not empty. He feels that there's urine left behind. So these are some of the classic symptoms of benign prostatic hyperplasia, which you could consider as benign or non-cancerous enlargement of the gland. And if these symptoms progress, it may culminate in what we call in Jamaica stoppage of water, or the medical term for it is acute urinary retention, where the man is unable to pass urine. And that is a very painful condition because the bladder is full and no urine can be passed. How is this condition treated? So in the specific case that was mentioned, the person had a biopsy, and which was negative, and there was no cancer found, indicating that the biopsy was negative, but they continue to have symptoms of BPH. So BPH, if it's causing bothersome symptoms, is usually treated with medication. There are two classes of drugs that are primarily used to treat BPH. In one class of drug, the prostate and bladder neck are relaxed. So the prostate is made up of smooth muscle and the bladder neck has muscle in it. And these drugs relax the prostatic smooth muscle and the smooth muscle of the bladder neck. And what that does, it reduces the resistance to the flow of urine. So urine flows in a stronger fashion and the person is more likely to empty their bladder. The other class of drugs is one that reduces the size of the prostate. And this is especially prescribed if a man has a prostate that is 40 grams or more. The normal size of the prostate is about 20-25 grams. So if a man has a 40-gram prostate and he has these symptoms, not only will a drug be prescribed to relax the muscle of the prostate and the bladder neck, but alongside with that, a drug will be prescribed to actually reduce the size of the prostate. If the patient continues to have bothersome symptoms, despite taking this medication, or God forbid they have stoppage of water or recurrent urinary tract infections, or it is affecting their kidney function, or they develop stones, or they're going into what is called chronic urinary retention, where there's a large volume of urine retained in the bladder, then these are indications for the surgeon, the urologist, to intervene and to what is usually done. If the prostate is small enough, we will, through the urethra, we will core out the center of the prostate. Here it is on a nice, on the slide. So here you see the resectoscope pass down the urethra, and we will core out the center of the prostate, just like you're coring out the center of an apple, to make the passage wider. And so there will be less resistance to the passage of urine. If the prostate is very big, then this method is not the best method. And in that case, we will do an open operation and we will enucleate the center part of the gland, which is the part of the gland involved in BPH. Okay, so that is how we treat BPH. There are other minimally invasive methods that involve laser and heat and other energy sources, but by and large, these are the methods that are widely available, certainly in Jamaica.
Thank you, Dr. Aiken. A very basic question that I think we didn't address at the beginning, and someone posted it in the group. They want to know, where exactly is the prostate?
Okay, well, if we could have this slide put up again, that would help us. So the prostate, and by the way, the prostate is one of the accessory organs of male reproduction. The primary organs are the testicles and the penis, but you have supporting organs, or what we call accessory organs, and the prostate is one of them. It is located deep in the belly button. It is found immediately behind the pubic bone. So if you feel the pubic bone, and the pubic bone can be found just above the root of the penis or the base of the penis. So the prostate is immediately behind the pubic bone. And behind the prostate is a rectum, as you see on that diagram. So you see the pubic bone in front and the rectum behind. So it's wedged between the pubic bone in front and the rectum behind. And on top of the prostate is the urinary bladder. And from the urinary bladder, the urethra starts right at the bladder neck, at the junction with the prostate. And the urethra passes through the prostate and then enters the root of the penis in the male. So in summary, the prostate is deep in the, what we call the bony pelvis, behind the pubic bone and in front of the rectum, and immediately below the urinary bladder, from which the urethra springs and passes right through the prostate. You can see in this diagram that the relationship between the rectum and the prostate is taken advantage of in examining the prostate. So when we examine the prostate through the rectum, we are taking advantage of this anatomical relationship that affords us easy access to the back surface of the prostate, where most of the cancers of the prostate arises. 70% of cancers arise in that back portion of the prostate.
Thank you very much, Dr. Aiken. When I switch to you, Dr. Stern, I see a question here asking, is a flu shot and vitamin B12 shot helpful at a time of COVID-19 protection? Re-COVID-19 protection. So are these things protective when we're talking about COVID-19? Vitamin B12 and the flu shot. Are you still there, Dr. Stern?
All right. I got distracted a moment. So the B12, could you repeat the question?
The person wants to know whether the flu shot and the B12 shot are helpful at this time when we have the COVID-19 pandemic. So I'm inferring that the person wants to know whether these things are going to protect you or help you to resist getting COVID-19.
The person is asking specifically about B12. But B12 and the flu vaccine?
Yes.
Okay. Well, strange, my experience, maybe I should try to answer the one about the flu vaccine. My experience with the flu vaccine has not been very encouraging. When I was in Germany, for instance, some years ago, and a clinic, the Yanker Clinic in Bonn, well, all the doctors were taking the flu shot, and I decided I didn't want it. Well, they got the flu and I didn't. So that wasn't very encouraging in my experience to see them getting the flu and I'm there without the flu. It is said that it is protective, but you know, the flu vaccine is made, the producers try to guess which strain of the flu virus will be prevalent in this this autumn, this winter, and produce a vaccine for that. So it doesn't completely protect against the flu. It is said that it can reduce the risk, but I believe that the measures to enhance one's immune system should take precedence, which should be, yes, using a vitamin B12 and vitamin C and vitamin D. And we hear a lot about vitamin D. We can be taking anywhere up to 5,000 units. That might sound like a large amount, but that can be helpful in enhancing the immune system. Vitamin C, 500 milligrams to 1 gram a day, and regular exercise, being careful to get enough rest, the 8 hours sleep, being careful to avoid anything sugar, anything sweetened. So really avoiding sweetened foods. And if a person is diabetic, of course, to limit the amount of naturally sweet foods. And getting enough water, the 8 ounces of 8 glasses, or somewhere between 6 and 8 glasses of water, that's 8 ounce glasses of water. And being careful to avoid cold drinks. And you know, those are some measures that the person I would recommend to use to reduce the risk of getting the flu. We could mention other things. So animal foods can reduce the resistance. So I'd say avoid red meat especially, and fried foods, and especially dairy products, cheese and milk, because those are mucus producing. So yeah, I'm not and my colleagues, and maybe some of you might have some more information about the flu shot, but generally speaking, I'm not a big fan of the flu shot. I think there are adjuvants in there that I'm concerned about.
Okay, thank you very much, Dr. Stern. And as you indicated, the flu shot has various serotypes of the flu virus in it, and basically each year they try and predict what serotypes are going to be more common in the next flu pandemic. Sometimes it's a hit and miss. Right. And so if the combination in the flu vaccine is not similar to the predominant type in the infection that year, then the flu vaccine will not be protective. However, there are certain groups of persons who them getting the flu would be devastating. So, for example, persons who have underlying lung disease or underlying cardiac disease, them getting a bad flu infection may be devastating, may cause them to die. So in those persons, it is recommended that they will get the flu shot, or some, well, physicians who are exposed to a lot of persons as well. That's a recommendation, but then we as physicians choose whether we want to take the risk or not. Okay. Right. Thank you very much, Dr. Stern.
And you could add on to that the protective measures too.
Correct. Correct. Excellent. So to Dr. Leiber, we haven't heard from you in a little while. This question is with regards to mental health. If someone is having suicidal thoughts, what should the persons who become aware of this do? So if I find out that someone is having suicidal thoughts, or if they have verbalized thoughts of suicide to me, what should I do as a friend or an acquaintance? What should I do?
Okay, thank you, Dr. Little. Well, first of all, you want to know if they have a plan. If it's just suicidal thoughts may come and they may be transient. You know, maybe part of a depressive episode or something happened and they feel despondent. You want to know if they have a plan. Have they thought out how they're going to do it? That makes it much more serious. And also, is there like a firearm at home that they may be planning to go and use? So all of those things, like a plan, is very, very important. You also would like to know, wow, have you ever done this before? Because a past suicide attempt is again another bad indicator. you need to just, you know, talk to them about what's happening in their life and so forth. And then you really should recommend that they speak to a mental health professional. If it's a transient thought and at the end of the conversation, they're more settled, they say they don't feel like it again, but they still need help, and you can refer them, you know, encourage them to go and see psychiatrist, psychologist, or a counselor. But if they have a plan and they seem very despondent and they're hell-bent on doing it, then you need to stick close to them and try to get help for them, either taking them to a like a hospital outpatient department, because they may need to be admitted for a day or two. Yeah, or if you have, like in the daytime, you have a mental health professional that can speak to them and assess the risk. That is also an option. But if they really seem like they're serious about it, you should not leave them alone until you have gotten help for them, and make sure that they are safely in somebody's care, a medical professional care, so that they will be prevented from harming themselves. Over.
Thank you very much, Dr. Leiber. Next question to you, Dr. Kin. The question is, I just missed it. The person was asking whether ackee or black pepper has anything to do with prostate cancer. And they also want to know whether a PSA, and you can explain what a PSA is, whether that is adequate, I guess, in screening for, they didn't say screening, but they just asked, is a PSA adequate?
Okay, so there is absolutely no robust evidence that eating ackee causes prostate cancer. None at all. There was a study done some years ago that demonstrated a link between higher grades of prostate cancer and a low ratio of omega-3 to omega-6 fatty acids. Now, we do know that ackee has a lot of omega-6 fatty acids in it. So if anything, that study may have suggested that persons who eat a lot of ackee, if they were to get prostate cancer, the grade or the aggressiveness of the cancer may be worse. But this was a small study. It wasn't a robust study, and it has not been replicated. And so what I say to my patients is that, you know, you can eat ackee, but eat it in moderation. In other words, don't eat it every day or every week. You can have it from time to time. But there's really, to answer the question specifically, there is no hard evidence that ackee causes prostate cancer. I have never heard of any association between black pepper and prostate cancer. So the answer to that is no. In terms of PSA, so PSA stands for prostate-specific antigen. Prostate-specific antigen is an enzyme. It is actually an enzyme, which is a protein that has a specific function in the body to catalyze a certain reaction. The prostate produces PSA, and when a man ejaculates, 20% of the volume of the ejaculate is made up of secretions from the prostate. And those secretions from the prostate has PSA in it. PSA, or prostate-specific antigen, its biological role is to keep semen in a liquid state. So it liquefies the seminal coagulum. It keeps semen liquid so it can flow easily in the female reproductive tract. So it's a very important enzyme in aiding fertility. Whenever there's any abnormality or any injury or any kind of perturbation to the prostate, PSA leaks across what is known as the basement membrane. It leaks across from the glandular tissue of the prostate across its basement membrane into the bloodstream, and it causes the levels in the bloodstream to be higher. So things like riding a bicycle, having a urinary tract infection, having an instrument passed up the urethra, having stoppage of water or what we call acute urinary retention, having a colonoscopy done or any manipulation of the rectum. All of these things, in addition to prostate cancer, as well as a condition known as prostatitis, where the prostate becomes inflamed, and BPH, which I spoke about earlier, all of these conditions can cause an elevation of the PSA in the bloodstream. So if the PSA is elevated in the blood, it does not conclusively indicate that someone has prostate cancer. It just simply tells the doctor that something is wrong with the prostate. The doctor will have to order further tests. Now, along with the PSA, we typically do what is known as the infamous digital rectal examination, or DRE for short. Why is this necessary? There are a small minority of men in whom the PSA may be in the normal range, but who on examination of the prostate may have an abnormal prostate. The normal prostate feels like the tip of the nose. It has a firm, rubbery consistency. When the doctor puts his or her gloved and lubricated finger in the rectum to feel the prostate, what we're feeling for is the consistency of the prostate, and we're trying to determine if there are any hardness, any hard nodules in the prostate that would suggest the presence of cancer. And as I said, there are a small minority of men in whom the PSA may be normal, but who may have nodules, hard nodules on examination. If you were to depend on the PSA alone, you would misdiagnose cancer in those men. So this is why it is important to do both the blood test, the prostate-specific antigen blood test, and the digital rectal examination, because both tests are complementary to each other. And if you don't do the DRE, there's a possibility you may misdiagnose in some patients with prostate cancer.
Okay, thank you very much, Dr. Aiken. There's a question for either Dr. Radlin or Dr. Leiber Thomas. My aunt of 88 years has dementia, Parkinson's, the person says dementia, Parkinson's, Alzheimer's, vertigo, and other ailments. The medications seem to make her sleep a lot. What can I do? Dr. Radlin or Dr. Leiber?
All right, so yes, I'll take that question in. It's not uncommon to have drug-induced side effects, and sometimes we add on medications because of those particular conditions progressing to a state where we're seeing psychotic features. And many times we order medications to treat those psychotic features. So for instance, when we have a person is presenting with these conditions, we often see persons becoming confused in the evening. They become aggressive. They may hallucinate in the evening. These are persons suffering from Alzheimer's and Parkinson's. And so to manage some of those psychotic symptoms which are commonly associated with this condition, you might be prescribing medications which treat the psychotic features, but bring on somnolence, drowsiness. So in which case, if the client is excessively drowsy, it may mean that a return trip to the treatment provider would be necessary to modify and adjust these medications so that we're seeing less somnolence, less drowsiness, and whilst not compromising the treatment of the psychotic features or the underlying condition, Alzheimer's and Parkinson's. So modification of the medications may be necessary in that case. I'm not hearing Sharon.
Oh, thank you. Thank
Okay.
you very much, Dr. Radlin. I see several questions coming in about women's health issues, endometrial cancer, cramps, and I'm going to probably defer these questions to our next session where we're going to be having a gynecologist obstetrician on who will better be able to handle those questions. I'm sure Dr. Stern can handle some of those, but in our next session, we'll actually have a gynecologist on. So we'll address some of those questions in our next session. Dr. Stern, there's a question here that's asking, what kind of diet would you recommend for someone who has sickle cell disease?
Okay. Well, sickle cell disease is a condition that is inherited. And so it's not something that somebody caught in terms of like a viral condition or a bacterial condition. So they have some malfunction of the red blood cells, which causes, can cause poor circulation and can cause emergency situations, as just for, that might threaten the life of the person, affecting the lungs and the joints, etc. So we want to focus on what can enhance the circulation. And what I would like to say here is that we need to make sure the person gets enough water to enhance the circulation at room temperature, avoiding the very cold extreme or very hot extreme of hot or cold. We certainly want to, and go back to what we said earlier, increasing the input of fruit and vegetables, which will enhance the state of health of the tissues, especially the vascular tissues. We want to reduce the animal foods, especially red meats, and oily foods, not just animal oils like fried food, but also vegetable oils are not necessarily the best, especially refined vegetable oil. Coconut oil, cold pressed, extra virgin olive oil and coconut oil, that can be good when used in the minimal amounts, preferably not heated. And that along with, well, some moderate exercise in enhancing breathing techniques to enhance the oxygen levels in the blood. This will be, those are the things I would like to mention here. And the trust in God, rest, we spoke about earlier, and as a general principles to keep to also follow. I should hope that this person doesn't smoke and doesn't use any alcoholic drinks. That is, of course, you know that sicklers, who are people who have a full-blown sickle cell disease, might not survive into the 30s or so, but hopefully even this person when they're in a condition not exposed too severely, they shouldn't think that if they should be free to smoke or drink, because those things can increase the risk of problems. So avoiding that is important. So those are the suggestions I'd make. And they can also use dietary supplements, vitamin supplements, vitamin C, again, vitamin D, and vitamin K. They help to enhance circulation. I'm not hearing it, Dr.
Thank you very much, Dr. Stern. Foliate acid is also very important in
yes,
sicklers as well.
it's related to vitamin C, yes.
Yes, indeed, indeed. This question is for Dr. Leiber Thomas. It says, what are the signs and treatment for children having psychological issues during prolonged stay at home? You know, all our kids are doing school from home these days. They're not getting out a lot. What are some of the signs that we need to look for to say that something is going wrong? And how do we try and avert this? Prevention is better than cure, I'm sure. But if there are major problems, how do we treat these?
Let me start with how we try to avert it first. Having to stay at home, what has been imposed upon us, right, is difficult. But for our children in particular, we as parents can make a big difference by our emotional tone and our state of mental health. So we have, as parents, have to make sure that we are as healthy as possible. The thing that children want a lot is they like routine and structure, and to have things as predictable as possible. So you as a parent, you have to now establish a new structure in the house, new routine in the house that is predictable. It will be more comfortable for them, and they'll feel that the world is more predictable and safer. All the other things like exercise and food, we have to remember all of that. And we also have to remember that they are not able to socialize physically as before, but they still need some connection. So whether you facilitate some phone calls with friends, I'm talking about the younger child now, or Zoom with like relatives, Zoom calls or Skype or FaceTime, whatever you call it, that would be desirable. And also it's an opportunity for family time, increased family time, to play games together or to do some other kind of activity together. I think, well, just to say that some children have like Zoom fatigue because they've just done, well, and even adults too, have just done too many Zoom meetings. So we have to take note of that, take a break. And particularly for our children, we have to caution them about, you know, the dangers of being online with predators who may try to take advantage of them. So some sense of cybersecurity and making them aware of what the dangers may be. Okay, what may you see? Actually, a study was done by CAPRI. I think it's the Caribbean Policy and Research Unit, and they found that children were showing significant signs of boredom. So I guess they'll tell you that they're bored. They felt isolated because, of course, they're not able to mix with their friends as before. They were feeling anxious. And again, as I say, they get anxious because the world is now less predictable than it was before. They don't know exactly when they're going back to school. All those things have kind of shattered the safety of life in a way. Some of them feel frustrated. We know that the online classes is not for everybody, and it takes some doing, and the parents have to get involved, and some parents are not able to get involved as well as they should, and parents weren't trained as teachers. So some of them feel frustrated, and they may get angry and be more irritable than before. They also found that they were sadder, and some of them were becoming more withdrawn and depressed. The young people have this thing called FOMO. You know of it, Dr. Little? Fear of missing out. FOMO, F-O-M-O. So some of our young people are feeling like they're missing out, but then everybody is in the same boat. So I guess it's not so bad. So those are the kind of things, but I told you really what to do to kind of to mitigate against these signs. And of course, if you are concerned and think that it's gone beyond what you as a parent can deal with, there's the helpline, you can always call it, and the Parenting Commission has set up parenting helplines in every parish. So those are also the resources. Let me say something that I should have added before about if you have a friend who is suicidal, the helpline may also be a resource for the friend, because we have counselors who are trained to speak to people who are suicidal. So that could be an interim resource before actually taking the person to the hospital to see if we can dissuade this person from harming themselves and be fairly confident that they, will not do so. So that is an interim measure, a possible measure. Okay, thank you.
Thank you very much, Dr. Leiber. Back to you, Dr. Aiken. This person is asking, can I get away with a CT scan or MRI of the prostate instead of a digital rectal examination?
Absolutely not. So those imaging studies are normally done after a diagnosis of prostate cancer has been made. An MRI and a CT scan are done in the context of staging the disease. In other words, determining the extent of spread of the disease. They have no role in the actual diagnosis of prostate cancer. You specifically diagnose prostate cancer by doing a biopsy and sending that where you take tissue from the living person, and you send that tissue to the pathologist for them to examine it under the microscope. And so that's how a diagnosis of prostate cancer is made. Those investigations that you have mentioned are helpful in screening and sometimes in targeting where to biopsy, but they do not have a role in and of themselves in terms of making the diagnosis. So they do not obviate, they do not negate doing a rectal examination, okay?
Just another question for you, Dr. Aiken. Can you say if a bicycle seat while riding can affect the prostate?
Absolutely. I mentioned earlier the things that can elevate your PSA, and bicycle riding is certainly one of them. I mean, this is something that is well documented, and we see it all the time where a patient comes in and they have a markedly elevated PSA, and when you take a careful history from them, they recently were riding their bicycle. So in a situation like that, in order to determine what the real or true PSA is, we would have to get the patient to stop riding and repeat the PSA. Now, PSA has a half-life of 3 days. And so we typically wait 7 half-lives, which is 7 3 is 21. So a minimum of 3 weeks before repeating the PSA would, that a minimum wait of 3 weeks would need to be done before repeating the PSA to see if it has come down. But yes, bicycle riding is one of the well-recognized causes of elevating your PSA.
Thank you very much, Dr. Aiken. I see a question here from West Palm Beach, Keith Byfield. I'm going to direct this one to Dr. Radlin. What can be done for someone who is suffering a chemical imbalance? I assume that this is a chemical imbalance of the brain.
Chemical imbalance. That is one of the ways we used to try and explain. We still sometimes use it to explain a variety of conditions. So many of the mental health conditions, be it depression, where you have low serotonin levels, and so we might explain that there to persons who may not have a strong science background, that persons low on these chemicals, low on these neurotransmitters are associated with depressive conditions. And in fact, when we've done studies on persons, studies showing in postmortem studies, 95% of the persons who committed suicide had depression or low serotonin levels in their CSF in some of the studies. When you look at patients with schizophrenia, where you have abnormal neurochemistry in the cortices of the brain, various parts of the brain, or even anxiety, where certain parts of the brain, the limbic system, are overactive and certain chemicals are associated. Again, some of the serotonin and other neurotransmitters there are not in the right amounts, or the neurons are not connecting with each other in a normal way. So yes, this can be used as an explanation, the abnormal chemical imbalances, but it's pretty vague in explaining any specific one in itself. How do you manage these different disorders? Of course, a history, thorough history, an examination with the purposes of ruling out underlying medical problems. We must rule out, when I talk to my residents, my medical students, I encourage them that they must rule out medical conditions first. Many medical conditions can present or manifest itself as a psychiatric condition. For instance, persons who are suffering from thyroid gland disorders can present with either depression, we have low thyroid levels, or if you have an excess amount of thyroid hormone, that's the gland in the neck here, that helps you to regulate your metabolism. If you have too much, you can present in a manic or anxious presentation. So you certainly, when you're managing these chemical imbalances, you have to rule out underlying medical conditions first. Similarly, many persons using substances can also present, like for instance, persons abusing alcohol, nicotine, caffeine, any substance, if abused, the body can use as become a normal metabolite of the body, and in itself produce further chemical imbalances, dependencies, and if you're not using it, cause withdrawal symptoms. So you must factor in the substance use problems when you're assessing persons with chemical imbalances. So must have a complete and wholesome approach to managing persons, rule out medical conditions, assess for substance abuse disorders, and of course zeroing in on the mental health problems and manage it with medication, sometimes with medication itself. So that would be my answer to that question.
Thank you, Dr. Adlin. On to you, Dr. Stern again. A question here. My daughter was diagnosed with an autoimmune Hep1. I assume that's probably hepatitis. So my daughter was diagnosed with an autoimmune hepatitis. What is the best treatment? We opted for a plant-based diet, no meds.
Okay. That's a challenge, I must say, because that sounds like we need to have some immunology analysis done there. I could say what a good foundation would be to, again, go on the general principle that we spoke of, the avoiding, if it's going to be autoimmune disease, you want to find out what might have been triggering that autoimmune problem. It can be exposure to chemicals in the environment that contributed to it. There might be some genetic inputs from inherited inputs, but certainly I say taking preventive measures would be very good here in avoiding chemicals that the liver would have to be dealing with. And that means avoiding exposure to insecticides, air freshener spray, chemical additives in foods. In terms of stimulating autoimmune system, the good naturopathic measure would be to use hot and cold contrast baths. This is very good for enhancing the immune system. But and there's a whole study in itself here where By that I mean, just for instance, immersing, for instance, the hands into a bath of hot water, hot enough to tolerate it, but not to burn one, for about 5 minutes, and switching to a bath of ice water for 3 minutes. That can enhance the immune system response. In some countries, it means like they're going into a sauna where the whole body is heated up, and then switch to a cold bath for a few seconds and going back into the sauna. That switch between hot and cold can enhance the immune system response. And we spoke about earlier the value of that, and we keep referring to it, the value of a plant-based diet, a whole food plant-based diet, and avoiding the refined foods, avoiding sugary drinks, as means to enhance the immune system. Supplements we mentioned already, especially using vitamin D and vitamin C, and the B vitamins from the grains and nuts. Then you mentioned folic acid earlier on, and that's come from the dark green leafy vegetables. So we want to use those approaches. There are herbs that can be useful too. And I think someone mentioned turmeric as a herb that can be helpful in enhancing the body's immune system. And there are supplements. The picture in the background has some nice black strawberries. I think it's blackberries or raspberries. And these, of course, have their can be potent stimulators of the immune system. So that can be just a beginning, I would say, to utilizing these things to enhance the immune system. We're avoiding the chemicals, environmental. I mentioned a chemical in the environment that is common is bleach. The chlorine in bleach can be very damaging. One should be careful not to inhale the fumes from chlorine. I think those are some of the things I could mention now. Automobile fumes also could be mentioned here. For if you're doing exercise, don't exercise on a busy road inhaling the exhaust from automobile, please.
Okay, thank you very much, Dr. Stern. And something we also need to realize that although we talk about boosting our autoimmune system, sometimes our autoimmune system goes out of whack in terms of it starts attacking self. So in some illnesses, like as the person indicated, hepatitis, autoimmune hepatitis, or things like rheumatic heart disease, it's actually the person's autoimmune system that's attacking their body. So sometimes in treatment of these illnesses, we have to kind of dampen down on the autoimmune system instead of boosting it up. So the issue of autoimmune hepatitis is really a serious one, and will need further consideration. I saw a question here. Someone asked, my daughter, let me see if I can find it quickly. My daughter has a slight swelling and odor in her left nostril. I checked her nose, but I don't see anything lodged in it, like in the past. Can you assist? Now, we don't have any ENT doctors online now, but I quickly messaged one of my colleagues who is an ENT surgeon, and she indicated that although you are not seeing something lodged there, there could still be something quite far back, okay? So the person still needs to be examined. So we'd recommend that you either go to a hospital, like Bustamante Children's Hospital, that's a shameless plug for my hospital, or your ENT specialist to have the person properly examined, because although you may not see something lodged back there, there may still be a foreign body. Dr. Aiken, I'm going to switch to you again. There's a question that I think the issue of digital rectal examinations is still quite topical. And the person is asking whether there is, okay, most normal men strongly object to anything being inserted in the rectum. Is there a less intrusive way to examine the prostate?
Okay, thank you for that question, Dr. Sherrard. So, while it is true that the digital rectal examination is an invasive test, over the years, I've been working at the Jamaica Cancer Society as a volunteer doctor from 1995, where we do a prostate cancer screening clinic. One is done every week. And so once a month I go there. And I've been doing that since 1995. And the number of men who exclaim that had they known, after having had the digital rectal examination done, that it was such a quick, painless test, they indicate that they would have done it many, many years before. I cannot understand why it is that, for example, women go through far more invasive and painful tests simply because they are concerned that they want to be there for their families and they want to maintain their good health. So women will have a pap smear where a cold metallic instrument has to be inserted in the vagina. The vaginal walls has to be pushed apart to scrape the cervix. That's a far more invasive and painful test than what a man endures. When a woman has a mammogram, it is also not pleasant. The breasts are squashed between the two plates of the X-ray machine. So why is it that men think that they cannot endure a test that takes 5 to 10 seconds that is not painful? Why they think they can't endure that to ensure that they'll be there for their families, for their children and grandchildren? A simple test like that. And, I really cannot understand it. Yes, as I said, it's an invasive test, but it is far less invasive than a pap smear, and yet women regularly go for their pap smears. And so, to answer the question specifically, I think it has to do with a lot of phobia and fear, and our society is said to be quite homophobic, and perhaps that is so. But I think it is quite ridiculous, actually, that men fear this test, a test that can possibly save their lives and allow them to live to a ripe old age to see their children and grandchildren. That's all I will say on the matter.
So what I'm hearing you challenging the men to do is to man up and get their prostates examined, right?
Right, and stop being a wuss, because that's what you are especially when compared to a woman who goes through all these unpleasant tests. And you as a man simply find it difficult to have a finger put in your rectum for 5 to 10 seconds to determine whether or not you may have prostate cancer. It is really mind-boggling to me.
Quick follow-up question, Dr. Aiken. I think you mentioned this before, but just for emphasis, what is the recommended age to do our prostate examination?
Okay, that's a very good question. So it depends on the population of men you're dealing with. In a high-risk population such as Jamaica, where the vast majority of our men are of African ancestry, and where the incidence and mortality from prostate cancer is high, The Jamaica Urological Society, along with the Jamaica Cancer Society, recommends that men start screening for prostate cancer at age 40. So at age 40 years, the recommendation is to start screening for prostate cancer. If you are Caucasian or you don't have a family history of prostate cancer, indicating that you are at average risk, then you can start screening at age 55. That's the guideline. But in Jamaica, we would recommend starting screening at age 40 years.
Okay, thank you very much, Dr. Aiken. The next question is for Dr. Leiber, Thomas. How do you cope with family members and friends not understanding your struggles with anxiety?
Thank you, Doctor. Thank you, Dr. Little. Whoa. Okay, that's a common problem because when somebody has really severe anxiety, the ordinary person doesn't really understand it. And sometimes you may look on and say, well, the person's life seems to be good. There's no big stressor, so why are you anxious? But if you have an anxiety disorder, sometimes severe anxiety just comes on like that. What I would suggest is to start the dialogue by maybe like downloading an article on it, or referring them to some sites and let them read it if they're of that ilk, if they would like to do that. So they could educate themselves about anxiety disorders. The other option that I see possible is that if you have a good mental health professional, you could invite them to come, share with your doctor the challenge you're having, and invite your family members to come and speak with the doctor, because maybe if they hear it from the doctor, they will be more they'll be more prone to understand what you're going through. Okay, thank you.
Thanks, Dr. Leiber. Dr. Radlin, a follow-up question on anxiety. The person is asking, can anxiety cause tension headaches?
Well, I wouldn't be able to say cause and effect, but certainly associations. We can say that yes, stressors, when you're trying to manage stress, you might be preoccupied or engage in coping mechanisms that are not necessarily the most healthy. You may stay up too long, not getting any rest, not exercise, these things, bad posture, poor diet, all the things that were mentioned before, Dr. Stern. So clearly mentioned, can be associated with tension headaches. So of course, managing the stressor, learning healthier coping strategies, managing the anxiety will obviously help to relieve the problem. So my answer is yes, there is an association. Yes, cause and effect, no. A little bit more difficult to prove.
Okay, thank you, Dr. Radlin. Dr. Stern, question: is there a correlation between eczema and an individual's diet?
Okay.
And that's coming from Tarina Williams, my cousin.
Okay. I'll try my best to answer that. I think there can be relation between eczema and the diet, yes. Of course, let me be careful to say that there can be an inherited tendency. A person can be born with what we call atopy, tendency to have outbreaks in the creases of the neck and the elbows and the knees. In which there can be like an allergy-like response to factors from the environment. And in this situation, you can have dietary factors that promote eczema. Commonly, dairy products is one of the commonest ones to think about, cheese and milk, but also wheat products, especially refined, modern wheat products, that you might have some genetically modern wheat, genetic modification rather, genetic modification in our wheat nowadays, and that can promote eczema. It is said that the corn products can also promote that, and animal products they can also contribute to that. It's thought that the chemicals that are used in tinned products that line the cans, those chemicals and MSG could also contribute to that. So yes, there might be environmental factors, that, or even our clothes, chemicals used in clothes. And so some persons can contribute to it. Detergents, residues of detergent in clothes could also cause skin problems as well. So that might be my short answer. The dietary factors could contribute to the eczema problem.
Thanks, Dr. Stern. Another question for you. This is with regards to sickle cell trait. The question is, can someone at age 55 have sickle cell trait and show no signs or symptoms? And I think the same person asked whether a child can inherit a mild trait from the parents, and is there any other way a child can inherit trait?
I'll try to answer that question, and pediatricians can help me here. A trait means a person doesn't have a full-blown expression of the disease. And it is possible, yes, that just how sickle cell gets transmitted to children, that both parents probably have traits and not know it. And then when two persons, for instance, with a trait get married and have a child, and that child, one of their children, might turn up with the full-blown disease because they inherit the sickle cell gene from both parents. So he might be 55-year-old and not have outborn evidence of the disease or obvious evidence of it. The last part of the question about the child, could you repeat the last part of the question?
They want to know whether the child can inherit the trait in any other way.
Any other way? Well, there's only one way to inherit the trait, is to get it from one of the parents. So I don't remember whether it's a male or female parent that they inherit it from, but certainly a sickle cell, as being a genetic thing, can only be obtained from through genetic means. So there's no other way that it could be, a trait could be inherited. And
Thanks,
do you answer the question?
Yeah, and 10% of Jamaicans have sickle cell trait, so it is quite prevalent. And there are a lot of persons walking around with trait who don't know that they have trait. And you may have absolutely no symptoms unless you are severely stressed, meaning very low oxygen levels around, which will cause the cells to sickle, or you become extremely dehydrated. So quite a few Jamaicans have sickle cell trait. In fact, sickle cell trait is thought to be protective against contracting malaria. So in areas in Africa where malaria is prevalent, persons who have sickle cell trait are at an advantage over persons who do not. So that's quite interesting.
Yes.
Dr. Aiken, I have another question here for you. It says, why is it that my doctor told me that having erectile dysfunction means that I may be at risk for a heart attack? I thought erections had to do with muscles.
I am so happy for that question, Dr. Little, because it gives us the opportunity to talk again about risk factors for both erectile dysfunction, and that these same risk factors are the same risk factors for what we call ischemic heart disease or cardiovascular disease, where you get narrowing of the blood vessels. It is absolutely true. What your doctor told you is absolutely correct. a man who has severe erectile dysfunction is at risk in a fairly short time of having some cardiovascular event, meaning either a cardiac event such as a heart attack or some other event such as a stroke. And the reason is simple. Remember, I told you earlier that an erection is what we call a neurovascular event. In other words, for an erection to occur, you have to have healthy nerves and healthy blood vessels. The healthy blood vessels allows blood to easily flow into the penis. The same process that may be going on in the penis to cause severe erectile dysfunction usually is going on in other parts of the body. So someone who has severe erectile dysfunction, it is considered what we call a biomarker for severe cardiovascular disease. And so somebody with severe ED may be at risk, imminent risk of having a heart attack or a stroke or some other cardiac event, because what it very likely means is that the blood vessels carrying blood to the penis have become narrowed, and that same narrowing of those blood vessels may be taking place in the heart and causing inadequate blood flow and inadequate oxygen to be carried to the heart muscles. And so, yes, it is absolutely true. And so it is very important when you go to the doctor for erectile dysfunction, it is extremely important that your doctor doesn't just give you a tablet to treat the erectile dysfunction, but your doctor should screen you for all the various risk factors for what we call atherosclerosis, which is a narrowing of the blood vessels. So your doctor should screen you for things like cigarette smoking, for diabetes, for high blood pressure, for high cholesterol. All of these things are important. Chronic stress, being obese and overweight, all of these things are risk factors for narrowing of the blood vessels, which may cause both erectile dysfunction as well as ischemic heart disease, where there is a narrowing of the blood vessels to the heart. So the answer is yes.
Okay, thank you very much, Dr. Aiken. I have two mental health questions that I wanted to direct to Dr. Leiber and Dr. Radlin. One of them is asking about the nutritional benefits of turmeric in helping to stabilize chemical imbalances in the brain. And the other question was to do with Alzheimer's disease and what are the early signs of Alzheimer's disease.
Let me allow Dr. Radlin. I don't know anything about turmeric and the chemical imbalance. I don't know if Dr. Stern can help us, but I don't, I'm not aware of any relation. So Dr. Radlin, over to you.
Right, maybe I haven't been doing enough reading. I haven't seen that study as yet. I'll do that check to see maybe there is. I don't know of it though. I need to double check that. What regards to the Alzheimer's symptoms, certainly if you see somebody misplacing their keys, leaving to get the stove on, not remembering how to get to various places, but even the bathroom in the house, these are some signs that something is amiss. They're not able to sew, to manage money, not able to do basic things in the house. These are some soft signs that they can't remember what date is. They can't remember the date, the year, the month, who's the prime minister. These are some of the questions we in fact ask in our assessments as part of our workup when we do a Minimental status exam, which will determine whether the person is showing mild, moderate, or severe symptoms. So if you have a doubt, if you have a question, of course, please carry your relative in and we will do our necessary screening and we will check to see if we can assist in this way. There are medications. In fact, depression, sometimes depression can present as if you are losing your memory, can look like a dementia, pseudo dementia. And in fact, the person is suffering from depression. And when we treat the depression, we see what looks like a reversal or improvement in the loss of memory, in function, in a more energy. Person has more energy, is more interested in going out and doing things. So we see what looks like our cure, what the person was really suffering from depression. So there are many things that we need to evaluate. Even some persons who might have tumors, brain tumors might present with some soft signs. And so, as I mentioned, there are many different types. Many persons in our population, as was mentioned, have non-communicable diseases, diabetes and hypertension. These things affect the small vessels in the brain. And so we see many, I'm being called more and more often to hospital to see persons who are having a change in their mental status. When the CT scan show that there are changes in the brain, and this was present there and the soft signs were missed, where yes, grandma or grandpa was not able to do certain things, was not functioning as efficiently as they used to. And so it might have been ignored and seen as, oh, this is old age. And so this is something that we need to get dispelled, where it's not normal to see persons suddenly decline in their once we see a sudden change in mental status, it needs to be investigated. So that's where I'd leave it. With regards to turmeric, I need to do my reading. Probably there is, I'm not sure. I'll do my checks, and next time we'll talk about it.
Another follow-up question, Dr. Radlin. Person is asking about walnuts. Does walnuts help in delaying Alzheimer's? Maybe Dr. Stern can weigh in on the turmeric question and add to the question about whether walnuts are good in delaying Alzheimer's.
Well, I've heard that claim that walnuts contain, I think it's related to the omega fatty acid content. Omega-3 fatty acid content contributes to the brain health. And also that turmeric, because of the content of curcumin, is a powerful antioxidant and helps with reducing inflammation. And it has been said that research shows that chronic inflammation and depression exacerbate each other, so that the curcumin in the turmeric can reduce inflammation and thus can help with relieving chronic depression and by relieving inflammation in the nervous system. So it should be helpful to use the turmeric as part of the regime to relieve depression. And of course, that goes back to the exercise. I think exercise is an excellent way for relieving depression by promoting the release of also hormones like endorphins. And the other question, yeah, the walnut you mentioned, yes. I can't say offhand what else might be in the walnuts, but I've heard it said that walnuts contain factors in enhanced brain health, including omega-3s.
I think just overall good health, good diet is gonna exercise help with overall health benefits, instead of identifying individual agents, turmeric or almonds or walnuts or whatever. We all need to practice good overall health in terms of diet, exercise, rest, and all these things are good. Another follow-up question for you, Dr. Stern. The question is, what is the best supplement that you would recommend for a vegetarian? That's a very interesting question. Should a vegetarian be on supplements anyway? Why do we need supplements if you're a vegetarian?
Exactly, I agree. There are concerns that maybe because of our modern lifestyle we are not able to get the wide variety of fruit and vegetable that we ought to be getting, and therefore a supplement might have to fill the gaps. So first of all, the best supplement is a wide variety of fruit and vegetables, in season, I might say. So with that in mind, because of nutritional content in food maybe not as good as they used to be, supplements can have a place, I believe. And there are brand names. I don't want to be promoting any brand here that might be promoting, doing some commercials here. So I would try to avoid that. But there are berries and there are vegetables that can be used in some whole food supplements. Well, I might use an example like Symmetry Corporation had such one. There are many other corporations. I see your picture in the background with the blackberries and strawberries and raspberries and blueberries. All these things promote brain health, as well as I think is a celery in the background or the parsley. I'm not sure. Those stalks, those pink stalks, they have a lot of. That red color means there's some good antioxidants in that fruit, and your grapefruit is that pink grapefruit that has important benefits in there too. So I don't want to name a particular supplement, but I say supplement to contain vitamin B complex, vitamin E, the full range of vitamin E, vitamin D, vitamin C, the biotin, folic acid, and you know, they might be coming from other parts beside the turmeric, get from ginseng, from so many things that we have, so many things we have in variety. I think we might not be able to mention every one, but fruit in season. So we try to eat the fruit in season and eat it whole, and we'll possibly eat the skins as well as eat the whole thing, because some fruit, the skin can be eaten, and there's a lot of nutritional benefit in the skin of most fruits and vegetables. I might say here that we have to be careful in washing our fruit and vegetables properly to get rid of insecticide residues and other chemical residues that might be on there. If the person is insisting on the name of a supplement, well, maybe we could have to talk one-to-one, but I would not want to speak of a direct supplement in public here, in case it might be unfair advertisement.
Okay, thanks, Dr. Stern. I think there are some concerns about B12 and it only coming from animals. You want to address that? Are there plant sources of vitamin B12?
Okay, a good question. Well, it has been said that we can get B12 from whole wheat products, from some other whole grains and legumes like chickpeas and or local gongo peas. We can get B12 supplement, not B12 in there, in that food, in those foods. If there's any concern about it, then maybe a whole egg once a week will be able to, should be able to supply that B12. Vitamin B, the bee pollen as well. The bee pollen also is said to be a good source of vitamin B12. So
okay, thanks, Dr. Stern. Trying to get to all the questions. We won't get to all the questions this evening because we have a few minutes left on the program. And there are some of the questions which, as I indicated before, in subsequent programs, we're going to have the health professionals who will directly address those. So some of the women's health questions we're not directly addressing this evening because we're going to have those specialists on in subsequent programs. I see a question here from earlier on about fluid on the lungs and how do you prevent fluid on the lungs. Dr. Stern, you want to take that on, or you want me to handle that one?
Well, you do that after, Dr. Littler.
It's a very general question. When we speak about fluid on the lungs, you may be referring to something that's called pulmonary edema. And basically the heart and the lungs work hand in hand, okay? The heart pumps blood to the lungs. The blood that goes to the lungs returns to the heart and then is pumped around the body. So if there's a problem with the heart itself, okay, the heart is not working, so you're having heart failure, then you may have symptoms such as being short of breath, getting tired easily, and your doctor may say that you have fluid on the lungs, okay? And how this is addressed is really treating the cause of the heart failure. It may be with medication to cause you to pee more fluid out, so there's less fluid overload. It may be with medication to strengthen the heart muscle itself. So it was a very general question, and maybe we could ask you for some more specifics on what you mean by fluid on the lungs. But in general, when you have fluid overload or extra fluid on the lungs, it's a problem with the heart itself. If you have an infection on the lungs, a pneumonia, then as part of inflammatory response, you will transiently get extra fluid on the lungs, but as the infection improves, then that fluid on the lungs will be reabsorbed and you'll have less of it. I hope I answered that question. Let me just see if I can quickly find a few more questions. There was someone who asked about bilateral hip cramps that runs down to the feet. We need to know more about the symptoms that you're having, but most times that has to do with a problem in the back where you have compression of the nerves by your disc. So you call it a slip disc or prolapsed intervertebral disc that's pressing on the nerves that are running down to the feet. If that is the case, then you'd really need to see your general practitioner or your neurologist, neurosurgeon. They would do some special investigations to see what the problem is, and then they can determine what is the best course of management, whether it is physical therapy, whether you need surgery, and things like that. Gonna try and pick up a few more questions because we're going to be wrapping up shortly. Dr. Stern, when using a cool humidifier, is it regular water? Is regular water as effective as spring or steam water? In using a cool humidifier, is regular water as effective as spring or steam water?
Well, I would imagine that regular water is just as good, because if you're going to be, the way the humidifier works is to create water vapor from a body of water, and whether it is pipe water or spring water, I think it is spring water, that's steam water, spring water you said? Whether
yes,
spring
that's
water,
what they were saying.
or pipe water, I don't say there shouldn't be any difference in you putting it in, although some humidifiers I think require that you should use distilled water so you don't get any residue in there to block up the works eventually. So to mean for the long operation of a machinery, probably it's best to use distilled water or reverse osmosis water. Otherwise, if you just to get steam, use regular water.
Okay, another question for you, Dr. Stern. What causes excessive sleepiness?
Well, well, we could start from with Dr. Aiken's presentations. Getting up frequently at night to go to the bathroom means loss of sleep. And that can cause a person to be very sleepy in the daytime, having had very interrupted sleep at night. Or just going to bed too late and not getting enough sleep can cause drowsiness. Perhaps the person is in a pre-diabetic situation, having high blood, eating too much sweets, or blood sugar tending to be too high. That can contribute to, foggy brain function, contribute to sleepiness. And thinking it out also, if what can interrupt one's sleep is sleep apnea. For people who snore and can have periods when they are not breathing properly, and that can cause some significant daytime drowsiness. People dropping asleep in the day, yawning, etc. in the daytime. It can be a side effect of medications. Certain medication Dr. Radley and Dr. Leiber will talk about that have side effect of causing drowsiness. I think there was somebody earlier on complaining about an aunt of somebody on medication making him drowsy. Yes, and exposure to, well, the exposure to fumes. There are certain fumes, chemical fumes from the environment that also could cause drowsiness. Those are some of the things I can think of. I don't know if I'm overlooking any as you can think of, Dr. Dr. Little, you might be able to help me here.
Okay, thanks, Dr. Stern.
I think, yes, the snoring. Snoring could have a
That's a big one.
Yes.
Obstructive sleep apnea. And on that point, I think in one of our subsequent programs, we are going to have a pulmonologist on. So in terms of obstructive sleep apnea, which I know several people suffer from, those questions will be addressed. One quick question to Dr. Radlin or Dr. Leiber on Alzheimer's, whether it can be slowed down. And after you answer that question, then I'm going to give all the presenters just 1 minute to just quickly, final points, closing points that you want to leave with our audience, and then we'll wrap up. So quickly, Dr. Radlin or Dr. Leiber Thomas, can we slow down Alzheimer's disease?
All right, so as was mentioned, there's the Alzheimer's disease is a disease where you have plaque, a protein being laid down in the brain. We can reduce the severity of the memory cognitive impairment by helping persons with specific medications in the early stages, but it's very difficult. We haven't figured out yet how to stop the protein deposition in that brain. And so the question is, we can't stop the protein, as far as I know, the protein deposition, but we can reduce the morbidity of the condition in the early stages with early treatment, with medications, with supportive care, with general improving health care, and a whole host of other interventions that we can use, non-medicinal interventions we can use. So that will be my answer to that question.
So in follow-up, Dr. Radlin, so these things that we see advertised on cable about stuff to improve your memory and slow down Alzheimer's and doing memory tests and memory games and all that, do those things really work?
Well, as I said, Alzheimer's is one type of the neurocognitive disorders. If you're speaking about disorders that the dementia that is caused by the vasculopathies, where you have an impairment in the blood flow to the brain, we can improve we can slow the worsening by trying to improve our general health, lowering our cholesterol, or controlling our blood pressures, improving our perfusions, the perfusion to the brain, taking medications to reduce the risk of clotting, that kind of thing. So we can, with good medical care, reduce the progression. There are some medications being offered out there. I can't speak to the efficacy of it. We know there are some medications in the early stages, which are helpful, but certainly when it's in advanced stage, there's really just palliative care that we'll be offering at that stage. So you should be mindful in selecting these medications. Have that discussion with your general practitioner and your local mental health provider in selecting these medications.
Okay, thanks, Dr. Radlin. Final question to you, Dr. Aiken. A question from a patient who has an enlarged non-cancerous prostate who wants to consider surgery due to urinary retention. They want to know, is this surgery major, and what would be the recuperation time?
Okay, so the type of surgery that is done is going to largely depend on the size of the prostate and whether or not there may be associated stones in the bladder, or whether there may be any abnormality of the bladder itself known as a diverticulum. In the vast majority of patients with an enlarged prostate in whom surgery is needed, the surgery is done through the urethra, as I mentioned earlier, and the most popular operation is called a transurethral resection of the prostate, where you literally core out the middle of the prostate. If the prostate is big or you have a high stone burden, then an open surgical procedure will be needed. Now, depending on which surgery the patient has done, the period of convalescence will differ. For your transurethral resection, which is the picture indicated here, typically the hospital stays 2 days. After the operation is done, you have a catheter put in. That catheter is removed 48 hours after surgery. And once the patient passes urine without any difficulty, the patient is sent home. The patient, however, while not on strict bed rest, is on reduced activity for up to a month after surgery, simply because any straining, any excessive efforts may cause bleeding from the healing prostate bed. If it's an open surgery where you have to make an incision and cut the belly bottom, then that patient typically is in hospital 3 to 5 days, and the healing process may take up to 6 weeks before they can return to full activity. So it really depends on the type of surgery done. Okay.
Okay. Any final thoughts, Dr. Aiken, for the
Sure.
men listening out there?
Yes. So I would like to encourage men, especially men who are 40 years and older, to be proactive about their health. The National Health Fund says your health is your responsibility, and that is largely true. It is not completely true, but it's largely true. It is the choices that we make regarding all the things that we discussed here today. Whether you exercise, whether you eat right, whether you get sufficient sleep, whether you maintain your weight, your ideal weight, as well as other factors that will determine your state of health in the years to come. In addition, ensuring that you go to the doctor at least once a year to get a checkup. And there are certain things that men need to check up for. They need to check on their prostate starting at age 40. Certainly Jamaican men do. And men 50 and older, and in fact, the recommendation has even come down to 45 years now, I understand, for Black men, a colonoscopy where the doctor takes a look at your colon using an endoscopic, a telescopic technique to look at the health of the colon is important. So screening is important beginning at age 40 for a number of diseases: diabetes, high blood pressure, prostate cancer, colon cancer. And so I would encourage men to be proactive about their health and adhere to the recommendations that we made this evening, as well as see their doctors at least once a year. That's it.
Thank you. Thank you, Dr. Akin. Dr. Stern, final thoughts?
Okay. First of all, it just occurred to me relating to the question about how to delay the onset of Alzheimer's or slow it down.
Yes.
It is said that advanced glycemic end products can enhance the deposition of these plaques in the brain that Dr. Radlin is referring to. And these enhanced glycemic end products, they're what formed when food is cooked until it becomes dark brown or black. So that's what you see like when bread is toasted and you get to the dark brown stage or brown stage. Inside that brown part of the bread are these ages, advanced glycemic end products, which said contribute to the speeding up of Alzheimer's. So I just thought I'd mention that. I've heard persons also talk about using the watermelon because of the nutritional components in there that also will help in slowing down the Alzheimer's. And foods such as those are the colors behind you, the red colors. In general, I'd like to encourage people to put in practice the New Start program, the nutrition, exercise, use of water, sunshine, temperance, which is using moderate use of what is good and totally avoiding what is bad, which means avoiding alcohol and tobacco. Proper breathing techniques, using air, rest and trust in God, and having a strong relationship with the Creator who can, and that it has been shown that people who have a faith relationship and have a regular religious basis in their life also experience better health. So yes, so we need to exercise and we need to eat properly and we need to do all these other things. And I encourage people to do these things to promote their immune systems, especially in these times. And that is just as good as considering vaccinations. Or not, I'm saying just as good, let me be careful here, politically correct. It can be very important in this, when considering this, and also as in considering vaccination.
Thank you very much, Dr. Stern. Dr. Leiber, closing thoughts? Dr. Leiber, yes.
Yes, I'm sorry. My closing thought is going to be short, that we have provided an avenue for people who feel that they're at the end of the road and they want some help. 888 New Life, 888-639-5433. Okay, thank you.
Thank you very much, Dr. Leiber. Dr. Radlin, closing thoughts?
Yeah, as I mentioned before, it's good to get a checkup from a neck up, and you need to get treatment early. If you're seeing, you think you need help, call, check, talk to a friend, get some be health seeking. So men out there, this is for the men today. We want you to come and talk to us. We will be willing to listen. We'll be willing to help to relieve the burden, so we don't see the outcomes that we're seeing. And that's my message for today.
Thank you, Dr. Radlin. So in wrapping up, let me just say a very special thanks to all the members of our expert panel. I think we have had a very good panel discussion this evening. The views expressed here were spot on. I'm sure that the listening public has gained a lot. I'd like to thank those who have logged in online and who have contributed all these wonderful questions. We weren't able to address all the questions this evening, and I'll apologize for that once again, but we're hoping to repeat this program in another month or so, and we'll have some other expert practitioners on. We'll be dealing with female health issues. I think we'll probably be dealing with the heart as well and the lungs. So some of the questions that weren't addressed, we'll address those. Quite a few questions were related to ear, nose, and throat. So maybe we'll need to get an ear, nose, and throat doctor on as well. But clearly there is a need for forums such as these so that we can address the questions of our public. I'd like to thank the Health Ministries Department, our capable leader, Dr. Cornwell, for organizing this all, for the members of the Communications Department who have worked in the background to make this presentation very seamless. Just want to thank everyone again for tuning in, and we'll end with a word of prayer. And then after the prayer, I'll encourage you guys to join the Let's Talk About Him program, which should have started at 5:30. So let's just bow our heads for a word of prayer. Our Heavenly Father, we just want to thank you for being part of this program. We know that you are the great physician. You have given us the knowledge and the understanding to take control of our own health. You have provided us with the health principles in your word. I pray that we will practice, and may we all have healthy, overcoming lives, we pray. In Jesus' name, amen. I thank you very much, everyone. And until our next program, thanks again. And